So I saw someone in my clinic this week complaining of severe fatigue. For those of you who are new here, I'm Dr. Alta Peter. I'm a board-certified obesity medicine physician practicing in the Maryland, DC area. So fatigue is a common complaint that brings people into the doctor, and it can be really frustrating, especially for someone who is trying to lose weight because they want to feel better, have more energy, be able to do the things that they want to do. This can be really discouraging. So in general, this kind of fatigue does deserve a pretty thorough workup. There are a number of things that could be contributing to having really low energy. Things like thyroid disease, iron deficiency, anemia, other vitamin or mineral deficiencies that can occur when somebody is working on losing weight rapidly, and a variety of other diseases and conditions. So that evaluation really needs to happen. But for this individual, we had done all of that and really not come up with any reason that she would be so tired. And ultimately what I determined was that she was just not eating enough. And I think this is really important for people to pay attention to. So for those of us who have been struggling with obesity for a long time, who have always been feeling hungry all day long, who have had that food noise all the time, when that gets shut off from an effective medication, that's really exciting, right? It feels like it gives you this freedom to stop thinking about food all the time. But sometimes that goes too far, and then people either just forget to eat, sometimes for long periods of time, or as in this case, they were deliberately eating very small meals or snacks, and thinking that that was enough, thinking that if they are eating less, that's just going to help them to lose weight more quickly. And that might not be the case. We know that there is a basic level of calories and nutrition that we need just to feel well, for our body to do its normal day-to-day functions. And if we're really calorie restricting below that, the body just kind of shuts down, right? Your metabolism slows down to conserve energy, and you're going to feel terrible. So for this individual, the advice I had was, you need to eat more. And specifically, you need to add back some carbohydrates. And, for those of us who grew up with this 90s or 2000s diet culture and vilifying carbohydrates, this is something that we sometimes have to be a little bit intentional about. And I'm not saying that you need to go and eat a giant bowl of pasta every day, but we do want to make sure that each meal that we have is well balanced, right? It needs to have adequate protein, adequate fat, and some source of carbohydrate, because those carbs are your body's initial source of energy. And so if you're not giving any of them, you're going to feel that sluggish feeling, really low energy, and just not able to do the things that you're excited about doing. So something to bear in mind. And if you need help, this is a great thing to talk to your prescribing doctor about, or even see a dietitian to get some good advice and tips about how to make sure that you're really getting in what your body needs while you're working hard on weight loss.